Hi, this is an example of one of the 15 core measures of meaningful use required to be met by the eligible professional to receive the reimbursement funds that are available. This is the core measure for medication orders. The objective is to use computerized provider order entry for medication orders directly entered by any licensed healthcare professional who can enter orders into the medical record per state, local, and professional guidelines. The measure is that more than 30% of all unique patients with at least one medication in their medication list seen by the eligible professional have at least one medication order entered using the computerized provider order entry. And it excludes any eligible professional who writes fewer than 100 prescriptions during the electronic health record reporting period. The computerized provider order entry, or CPOE, entails the provider's use of computer assistance to directly enter medication orders from a computer or mobile device. The order is also documented or captured in a digital, structured, and computable format for use in improving safety and organization. A unique patient is one that is seen by an eligible professional more than once during the electronic health record reporting period. Then for purposes of measurement, that patient is only counted once in the denominator for the measure. All the measures relying on this term unique patient relate to what is contained in the patient's medical record. Not all this information will need to be updated or even be needed by the provider at every patient encounter. This is especially true for patients whose encounter frequency is such that they would see the same provider multiple times in the same electronic health record reporting period. The attestation requirements are for a numerator, which is the number of patients, and the denominator that have at least one medication order entered using the CPOE. The denominator is the number of unique patients with at least one medication in their medication list seen by the eligible professional during the EHR reporting period. Exclusion: eligible professionals who write fewer than 100 prescriptions during the EHR reporting period would be excluded from this requirement. Eligible professionals must enter the number of prescriptions written during the EHR reporting period in the exclusion box to attest to exclusion from this requirement. The resulting percentage, numerator divided by denominator, must be more than 30% for an eligible professional to meet this measure. The provider is permitted but not required to limit the measure of this objective to those patients whose records are maintained using certified EHR technology. Any licensed healthcare professionals can enter orders into the medical record for purposes of including the order and the numerator for the objective of CPOE if they can enter the order per state, local, and professional guidelines. The order must be entered by someone who could exercise clinical judgment in the case that the entry generates any alerts about possible interactions or other clinical decision support aids. This necessitates that the CPOE occurs when the order first becomes part of the patient's medical record and before any action can be taken on that order. Electronic transmittal of the medication order to the pharmacy, laboratory, or diagnostic imaging center is not a requirement for meeting the measure of this objective. However, a separate objective contained in EPCMU 04 addresses the electronic transmittal of prescriptions and is a requirement for eligible professionals to meet meaningful use.